This is a Dubai Eye 103.8 podcast.
This is Afternoons with Helen Farmer.
Live your best life.
I can't stop the feeling.
On Dubai Eye 103.8.
We love talking health on the show, connecting you with the best experts across a range of specialty areas. We were joined by Jordana Venskic. She is a nutritionist, dietitian, explaining who qualifies as a picky eater, when is it necessary to seek professional help, and answering your many questions too. Let's just say I'm not alone in having a picky eater at home. We were also joined by Dr. Husnia Gargash, answering all your pregnancy-related questions. When should you consider IVF treatments, and what are the various methods? And what is the difference between a psychologist and a psychiatrist? What actually happens in a therapy centre? We were lifting the lid with Tuba Siddiqui from the Kamali Clinic. And staying with psychology, the big discussion today was imposter syndrome. What is it? How do you know when you have it? Dr. Thuraya lifted the lid on that, clinical psychologist, explaining why some of the people experience symptoms of imposter syndrome and, crucially, what you can do about it.
Healthy habits.
On Afternoons with Helen Farmer.
It's all about picky eating. And it happens to the best of us, despite our efforts to plan and shop and cook up a nutritious meal for our kids. Sometimes the only thing they'll agree to eat is beige or from a packet or the freezer. And having a picky eater at the table in the family can be really frustrating, whether that's a child or an adult. And it can be quite worrisome at worst, to be honest. So how do you know if your child's getting the nutrition that they need for healthy development? Well, of course, we have an expert on the line. Jordana is with us from JV Nutrition. She consults at Malak and Genesis Clinic as well. How are you, Jordana?
I'm very well, and you? Thanks, Helen. Thanks for having me today.
Well, I think you're going to be very busy because everyone I speak to has some element of a picky eater in their life.
Yeah.
It could be a sibling, it could be themselves, but most often it is the child. And I've got two picky eaters. I wouldn't say they're extreme picky eaters, but it's enough to cause frustration. It's enough to cause a bit of social anxiety when we go to people's houses. Is there going to be something they want to eat? If we go to a restaurant, is there going to be some form of French fries? There is going to be something in their tummies at the end of the evening. Do you have kids yourself, Jordana?
I do. I've got a little 2-year-old, so I've got one child who also, it's 45% of children are going to be having some kind of feeding issues. So you're not alone when you're looking at a child that's picky. It's something that all toddlers are going to go through, and then it's how we deal with it, whether it's a long-term thing or if it's just a stage that they're going to go through.
I'm glad you mentioned that your child is 2, because that's when I started having trouble with mine. They were great. I've got photos of them with, holding bits of broccoli and, chewing on it happily, and me, all these smug photos. Oh, look how much she loves her, blah, blah, blah. Then they turn 2. Then the opinion starts being made. They start asserting their own thoughts. Does there tend to be an age or a milestone where things can turn a bit?
That's exactly when things do turn a bit. So at around 18 months to 2 years of age, children are starting to be a little bit more independent. And the easiest way for them to be independent is actually through food. It's one of the easiest ways that they can say yes or no. I just need to close my mouth, and you can't force me to put something in my mouth.
You can try.
You force it in, I'm going to spit it out. Yeah. And they also go through something called neophobia. So food that was familiar all of a sudden becomes a little bit scary.
That's interesting, because what I've found speaking to lots of friends over the last few months is during this lockdown period, during a time where those routines and those regular places have been taken out away from children, they seem to be asserting themselves on the food front as well. And I just wondered if you noticed any common concerns or trends over the last few months from some of the clients you're seeing.
So absolutely. The routine is a big, big thing. Everybody is kind of saying that. Once children were eating really, really well, now they're out of school, they're out of nursery schools, the routine is gone. So now kind of kids are just looking at food and going, I want to eat all the time. So we also are seeing children that aren't hungry when it comes to meal times, and then they are classified as being picky eaters, but aren't really picky eaters in those cases. They're just essentially full. But then that routine is a big thing. Children thrive on routine, especially little kids. They need it so that they have an expectation of what's to come, and it helps them with all their processing that's going on with their brains to actually then sit down and eat the meal.
I think the penny just dropped for me because I've got kids who are like, can I have, and sometimes it's healthy. Sometimes like, can we have a red crunchy apple? They're very specific. Or, rice cake or cookie or whatever it is. And then as you say, it comes to mealtime and they're just not that bothered. But that's what a lot of people have been doing when they've been working from home. And I would include myself in that, just gravitating towards the fridge, a little snack here, a little snack there, and grazing rather than eating. So there isn't that impetus to then have something and have that hunger when it comes to actually mealtime. Lots of questions coming in for you, Jordana. James has got in touch simply asking, should I be giving my kids supplements? We see these marketed a lot, the gummies, and there's all sorts of talk about being natural and making sure your kid has everything they need in their system. How do you feel from your background with giving supplements, and when is it necessary and when is it to be avoided?
So generally speaking, supplements aren't going to be necessary at all for any child, for any adult. It's really what we're looking for is you're trying to get your nutrition from your food, because we know that the absorption of any of these nutrients is better when it's in combination with other nutrients or other food particles or food things that you're eating. So supplements I only really recommend when I can see a child has got a very, very limited diet. So not a picky eater, with somebody who would be more classified on the problem eater spectrum, where they're eating less than 10 varieties of foods. And then we can start to look at it and go, well, we're missing out on huge essential nutrients here. Now we would potentially supplement, but the goal isn't to just look at it and go, well, I'd rather just supplement and not expand their diet. Mm-hmm. We ultimately do want to get them expanding their diet, and just using supplements almost as a tool to create a little bit of an appetite in them as well.
Because I think that would be my mindset as well. It's like, oh, they've had their vitamins. I'm not that bothered if they just have some, toast and honey, or or whatever it looks like.
Exactly.
It can lead to a bit of complacency. I'm glad you mentioned there when things are quite serious, and I just wondered, when does a dislike turn into something that perhaps is cause for concern?
So we would be looking at all picky eaters as we wanting to kind of catch them. So like I said, 45% of all children are going to be picky eaters. Then if we're able to kind of solve that, around only 25% of that 25% can turn into problem eaters. So it's kind of 10% of the population of children can become problem eaters. And when we would be classifying you as falling into that problem feeder category is when your child is eating less than 20 different variations of food things. So it's not just saying they don't eat vegetables. It's actually looking at it and going, what are we down to exactly 20 foods or less than 20 foods? And then we're looking at more of a serious case where more proactive feeding therapy is going to be needed.
We're going to be talking about some of the therapies as well. I just wanted to ask about sensory issues with foods. This seems to be something that's in the news quite a lot around kind of sensory processing and textures as well.
It's one of the biggest reasons why we have picky eaters. And when we look at how children are actually kind of taking in food, the first thing that they're doing is they're looking at food. So their sight is being triggered. And then it's moving through the rest of the pathway. So we've got sight, we've got smell, we've got touch, and then only finally getting to taste. And then also triggering the sound of food, so triggering my hearing. And so when we're looking at the whole sensory integration, how they're putting everything together, that's one of the biggest reasons why we actually have picky eaters or problem eaters, is that they can't put everything together and make a pathway that their body and their brain is actually able to process and say, this is how I know how to eat broccoli, for example. So why food play is so important.
Yeah. It's funny you mentioned broccoli, because I mean, I'm a fairly normal human being. I've got likes and dislikes, and broccoli is very much on my list of dislikes. I just don't like it. And then I struggle with my kids, and I'm like, here, eat your broccoli. And I'm like, ugh. But I think for some people, and I would definitely include myself in this, it tends to be sometimes a bit of a history around why some foods are problematic. So I despise bananas. Can't cope with them. You can put them in bread, you can put them in smoothies. I will sniff them out and I will reject that food. And I think it's because I had tonsillitis a lot as a child, and I was given this really foul banana-flavoured medicine. And since then, I just cannot deal with it. So sometimes there seems to be some kind of reasoning behind it, but sometimes it seems a bit more irrational than that, which presumably is a bit more challenging to tackle.
Yeah, so the more of the kind of the irrational things are way more difficult to tackle, and most of it all is always going to come down to that sensory aspect. So what is the child actually experiencing when they're seeing it? Essentially what we're looking at is the child looking at that food and seeing it as something safe, or are they looking at it and seeing something as unsafe? Mm-hmm. That's the bottom line, actually. And so you mentioned broccoli. You don't really like it. You don't like broccoli. And then when you're giving it to your children, you don't really notice, or you wouldn't pick up what's your face looking like when you're offering them broccoli. What are you doing? Because your children are watching you all the time, and they can see that little kind of lip twinge or something that you're going, enjoy the broccoli.
No,
and
thanks.
they're looking at you and going, why aren't you eating it? And so automatically for your kids, it's going, well, mom's not eating this. So there's obviously something wrong with this food. That's exactly it. They're looking at it and going, well, the people I'm learning from don't eat this food. How am I meant to eat it?
Message here saying how to know what the ideal portion is. I think that's a really good point, because this has become so skewed over the last, well, just in general, to be honest. And I don't want to point the finger at Americans, but they seem to go for a lot bigger portions. How do we know how much our child should be eating? And I presume we have moved away from the you need to clear what's on your plate mentality.
Absolutely, we've moved away from that. It's about looking at their hands, really. So it's not that they have to be finishing the portion that we're putting down, but just when we're putting a portion down on a plate, make sure it's something that's achievable for your child to actually finish. So most people actually serve up for our children about 4 times more than what they're actually capable of eating. So already we're putting them on a back foot. So where you're wanting to start off with a plate is looking at your child's hand and 4 carbohydrate servings. So this would be your rice, your pasta, potatoes. It would be something the size of their fist. So for a 3-year-old, it's only about 2 tablespoons of rice, for example. Your protein serve would be the size of your palm. So again, a 3-year-old looking at a chicken breast, it would be around a quarter to a half of a chicken breast, depending on the size. And then your vegetables would be 2 open handfuls for your child. So a 3-year-old, let's look at something like cauliflower. It would be 2 to 3 florets, depending on the size of that. That's what you would be starting with. If they're wanting to eat more than that and they want to have 5 times that, it's absolutely fine if they are guiding it. As well as if they don't want to eat all of that portion, it's also fine because they're in charge of their appetites. But that's a good starting place for us to go. And most of us will be serving way more than that to our children.
Definitely. Can I ask where you stand on bribery and, reward charts, star charts and things like that, Jordana?
So I am anti them completely if we're using food as the bribe and as the reward. It automatically is going to be putting that food on a pedestal and be going, this is the food that I need to try and strive and work towards getting. Use them, but use them for other things. So for extra time with mom or with extra time with dad, you can stay up 5 minutes later. We can watch a movie on the weekend. We can do these types of things, not using food.
So when you say that, what about trying new food? So if you try 10 new foods this week, then you can stay up late and have popcorn with mum and dad. Is that the kind of thing you're talking about? Or we shouldn't have anything food related on a star chart at all?
We shouldn't have anything food related on the star chart at all.
Okay.
So it's changing that language and going, we're not going to ask you to try something. It's just that here is the food that I'm offering you, and you've got a choice of if you're eating it or not. So it's again looking at that. Somebody mentioned it earlier. It's not about that children do we starve them, do we not starve them, use the reward to try to get them to increase their palates. It's about looking at it. Our children can actually starve themselves depending on how severe their feeding issues are, because they lose the ability to know when they're full or when they're hungry. So as soon as we start to say, if you try 10, then you'll get X, that's taking away their ability to also know, am I hungry, am I full, what actually do I need? And if you actually watch children and watch them kind of going through their growth, you might notice that at points your child really focuses on carbohydrates or really focuses on proteins. And then you start to look at what have they been doing. If your child's been really, really active, no wonder they're wanting more carbohydrates. Or they're going through a growth spurt, no wonder they're wanting more proteins. And our children have, if we leave them alone and let them show us, they know exactly what they need when they need it to optimize their health.
Breath of fresh air, Jordana. You really, really are. Thank you. Last question is going to a grown-up. Rathika saying, I don't feel like I'm a picky eater. I love experimenting, trying new cuisines, but there are some ingredients I just cannot stand, like cilantro or parsley. Just can't stand the taste. Is this something I should be worried about, or could I change it? No,
that's absolutely fine. That for me wouldn't be a picky eater. That is, we do also just have preferences. There are some foods that we just are not going to like. And we're all perfectly entitled to do that. It would be more of a thing if you're an adult and you aren't eating any kind of meat proteins, but then you also aren't supplementing with a plant protein, for example. So you're actually losing out on whole food groups. That's when there would be more of an issue. It's not just, I don't like the flavor of that. That doesn't matter.
Good. Apologies to anyone we couldn't get to this afternoon. It's been a really, really busy show. It just goes to show just how common these issues are, Jordana. But what's the best way of people getting in touch with you and perhaps getting some one-on-one advice or following some of your information online?
So people can get in touch with me via Instagram. So my Instagram handle is jv_nutrition, or they can email me at hello@jordana.life. So that's my email address. Or get in contact with Malik or Genesis. One of those places will also be able to book a consultation with me.
And do you have any workshops or anything like that coming up if people wanted to come along?
I do have fatty eating and weaning workshops coming up that I run through Malik. There'll be the new dates for September aren't out yet, but I normally do them on a Monday evening or on a Saturday morning, and they pretty much run twice in the month, so there is a time available for all of those.
Brilliant. I cannot thank you enough for some really sensible advice this afternoon. I know you've busted a few myths and put quite a few people straight today, so I'm going to go into the long weekend with a different mindset. I'm going to try my best, and we might do some painting with broccoli, and I might even try it myself. Jordana, thank you so much. Really, really appreciate it.
Healthy habits.
On Afternoons with Helen Farmer.
It's Thursday. We always round up some of our favourite healthy experts. And talking IVF now, Dr. Husnia Gargash is with us, Director and Consultant of OBGYN here in Dubai. She's also got a subspeciality in reproductive medicine and a really strong fertility expert. She's a member of the British General Media Council, and delighted to have her here in Dubai, as I said, the Director of the Fertility Centre there. Doctor, how are you today?
Fine, thank you.
Good. I just want to kind of pick your brains on what might seem like obvious information to you as someone who is a fertility expert and talks about this day in, day out. But I feel like there's an awful lot of kind of mystery around some of the techniques and methods that you use. And I just wondered, when you look back at your experience over the last few years, have you noticed any trends, any rise in the number of people struggling to conceive?
Yes, there has been rise in a number of people who are trying to conceive. And this is mainly because of women becoming more educated, so working, delaying their pregnancy, number one. Number two is that we're getting more and more patients with poor ovarian reserve, and that is because of stress, type of food that we eat, our weight, use of recreational drugs, use of smoking, alcohol, all this would affect the number and the quality of the eggs that we produce. So yes, I have been seeing this, and also with men, because of their job stress, lack of exercise, use of fast food, women especially. There is a proof that eating fast food can increase your time to pregnancy because it can affect the quality of the eggs. So all these changes that's happening around us affecting us. Our environment is not only affecting the fish and the trees and the plants, it's affecting also the humans and their fertility.
Can I ask you, at what point do people need to get help? Because that's one of the questions that we get a lot of the time. How long do you try before you reach out to get professional help?
I think first, once you get married, a woman gets married, it's better that she goes for a checkup just to make sure that she has got no problem, because sometimes they have the problem and they're not aware of it. So it would be advisable that they would just do a check, her and her husband, and then if there is nothing wrong, they can, and the woman is less than 35 years, she can wait for a year. But if she is 35 and above, then she should just wait for 6 months. And then if she didn't get pregnant, she's got to go and try for help.
You mentioned they're going for a check. What would a doctor be looking for? Let's start with the woman. Are you looking at the number of eggs or quality of eggs, and what kind of procedures would need to be done to establish fertility at that stage?
We need to see first the woman, the tech history from the woman, because sometimes some women would have lots of operations. Sometimes they have got endometriosis, for instance. They wouldn't know that endometriosis could affect their ovary, their chance of pregnancy. Sometimes they had an operation on the pelvis, such as adhesions because of infection, because of a removal of an endometrioma or ovarian cyst. So this would reduce their chance of natural conception. So it's important that the history. So from the history of the patient, we can find out if there is any significant factor that could affect their fertility. Then it would be examination and ultrasound scan, and we have to see the ovarian reserve by scan and by blood test. There might be some other problems. You might be having hyperprolactinemia, that prolactin is high, or it could be that she has got thyroid problem, because we are getting more and more patients with thyroid problem due to autoimmune disease. So all this can affect her chance of pregnancy. And some of things are simple and it can be corrected, as if it is a thyroid problem, prolactin problem. But other things, if she has got problem with her ovarian reserve, then it is more serious. And that situation, we have to discuss with her what to do next.
And what about the man, presumably just checking for quality and mobility of sperm?
Yes. So we do one semen analysis, and if the semen analysis is fine and she is fine, then they can wait depending on her age.
We hear an awful lot about things you can be doing in your life and your lifestyle and changes you can make to become more fertile or to kind of, compound the effectiveness of different assisted techniques. I just wondered, are there any natural remedies or lifestyle changes that you advocate with your patients?
Yeah. First is that they should avoid fast food, okay, because the chemicals that is in the fast food can affect the quality of the egg. So it can reduce her chance. It increases the chance of, it will delay the pregnancy. So fast food, you should avoid the fast food. Exercise, try not to smoke and drink, and also to concentrate on the type of food that she eats. So she would not take things that would be fattening, and it would not. To eat a variety of food, fish, meat, chicken, vegetables. Reduce the carbs. So this is for the food, and have good sleep, good exercise. This is for her lifestyle. As for the man, also the same thing. Should try not to. His weight is important, because if he is fat, then there is increase in the scrotal temperature, and when there is increase in scrotal temperature, this can cause reduction in number of the sperms, and also it can cause chromosomal abnormalities because of the temperature of the scrotum. The other thing is that smoking, stress. Okay, all these should be avoided. So exercise, try not to smoke, try to reduce weight. All this can help in improving the chance of pregnancy. And women, if they have got poor ovarian reserve, also we give them some tablets that could improve the quality of the eggs.
You mentioned stress there. I think the irony for a lot of people is that trying to conceive is incredibly stressful, and trying to be calm and positive can feel like a genuine barrier and sometimes a bit of an impossibility. So getting the help that you need and feeling like you're in the best possible hands must go an awful long way. And we've had a number of questions for you, Doctor. I'm going to try and get through as many as we can. Karina's texting saying, is IVF painful, and what is the success rate? I've already been disappointed enough throughout my journey to conceive, and I don't want to hear bad news again. Can we talk a little bit around success rates and what the questions you should be asking a clinic are? Because there seem to be a lot of clinics making some very big promises.
No, you are supposed to be telling the patient. After you see the patient, both the husband and wife, you have to explain to them what are their chances. But sometimes also patients are asking for things that is impossible. Like, for instance, patients coming at the age of 49 and they want to get pregnant because they got married very late. When you try to explain that, it is it's extremely difficult, almost impossible to get pregnant, because here we don't have this limiting the time, the age, the upper limit of age for conception for women, like in Europe. So the women, and then there is no egg donation also program here, because it is not allowed by by the law and by the religion. So sometimes the expectation of the woman is higher than possible to do it. But from after you take the history from the patient, you would say you would be able to know, and doing examination, and then you would be able to explain to the patient what is her chances of conception. Such, for instance, generally it is 40%, because why we say 40% chance of pregnancy all over the world They will be sometimes higher or lower depending on number of eggs, quality of eggs, age of the woman, age of the factor that caused the infertility. Or sometimes would be less than that, again, depending on the same factors, which is age, quality, number of eggs, sperm quality. So you have to be realistic with the patient and explain to her what is her chances. But sometimes patients, when you tell her, for instance, okay, you've got poor ovarian reserve, you are above 35, you're 37, 38, your chance of pregnancy is 30%. She would be, she feels that, oh no, what is this? I was expecting more than that. But this is the truth, because once we hit age of 35, our eggs as humans, 50% is chromosomally abnormal. So whatever we would do, there's 50% chromosomally abnormal. So how are we going to correct that? There is no way of correcting that. Yes, we can do PGTA and diagnose that this embryo is normal or abnormal, but would it increase my chance of pregnancy? No. It would not increase the chance of pregnancy. It will just shortens the time to pregnancy, but not increase the chance of pregnancy.
Are you able to explain some of the different methods, Doctor, of assisted reproductive techniques? Because I feel like everyone thinks of IVF and they think that it's just one, whereas there are some steps you can get to before that.
Yes. It depends, again, on the history of the patient and on the physical examination. Sometimes they are, you can see that, it's a very simple thing, like a patient who is married recently, young, but they want to start family quickly. Then in that situation, you could tell them, for instance, how often they should have intercourse. Sometimes they don't know about this. Okay, so how often they should be having intercourse in order to improve their chance of pregnancy. Sometimes we think that, this is a simple thing. We can just pinpoint the time of ovulation, and so we tell her, come on this specific day. We're going to check whether you're ovulating or we are starting to ovulate, and then we would tell them, go and have intercourse at this time. Sometimes we give them an injection in order to produce, to make her ovulate, and so we would know the timing of ovulation. We tell them to have intercourse. This is called OI, which is ovulation induction. Sometimes the ovulation induction is done with medication, so we give them tablets and injections, or injections only, and then we tell them when to have intercourse. The disadvantage of this method is that the chance of pregnancy is around 10 to 12%, and the chance of multiple pregnancy. The other thing is that we could tell the patient we would do ovulation induction and AIH, which is artificial insemination with the husband's semen. So we give them injections and tablets, and then we would pinpoint the time of ovulation by giving them HCG, and then the husband comes, we do the sperm wash, and we do injection inside the uterine cavity. Then the chance of pregnancy will be a little bit more, say maybe up to 15 to maximum 20, usually 15% chance of pregnancy per attempt. Then it comes the last one is the IVF, and that IVF is usually done if the husband's semen is normal, has got no problem, but the woman is having a problem, such as she's having tubal factor, so the sperms cannot get to the egg, and so we do IVF in this situation. So we put the sperm and eggs together, and once they fertilize, then we transfer. And then there is the ICSI, which is if the husband has got a problem, and then we inject the sperm inside the egg. And the difference between IVF and ICSI, both of them are done in the lab, is that the chances of abnormalities with ICSI is a little bit more. It is about 6% as compared to 4%, which is the abnormalities that's seen in the general population. And that 2% is usually because the husband has a problem, so the child could be having the same problem like the husband, like some abnormalities in urogenital tract.
Doctor, thank you so much for your time this afternoon. Dr. Husnia Gargash, a director and consultant there in Obstetric and Gynaecology at Gargash Hospital. Thank you so much for your time, and wishing you a wonderful weekend. And thank you for all of your amazing work with all the amazing families.
Healthy habits.
On Afternoons with Helen Farmer.
On the line now, we've got Tuba Siddiqui. We are talking about what actually happens when you go to therapy. How are you, Tuba?
Hi, I'm good. Thank you. How are you?
I'm good. I feel like this is such a valuable conversation, to be honest, because, we talk about the importance of looking after our mental health, and we all know what that could or should involve, but there still seems to be an awful lot of mystery and sadly stigma attached to reaching out to get help or having some kind of talk therapy. And I also feel like there's also quite a bit of confusion about what everybody does and why. So one of the main confusions seems to be the difference between the different roles, the different people that you might go and see if you are struggling. Or need a bit of extra support. What is the difference between a psychologist and a psychiatrist, please?
So psychologists basically have to complete their bachelor's and further go on to receive their master's or PhD or doctor of psychology. And then they have to take this doctorate program for about 5 years and then a further of 1 to 2 years for licensing. So it takes a total of around 10 years. Whereas on the other hand, psychiatrists also go through a similar amount of time because they have to complete their MBBS, a doctoral degree, and then a medical degree, and then they have to further do specialization in psychiatry, which takes them around the same time, that is 10 to 11 years. That is post-high school and or college. So they have specific training in the assessment, diagnosis, treatment, and prevention of mental illness.
You have an MA in clinical psychology. So you're now at Kamali Clinic. They've got a joint venture and operating from Medcare Medical Centre in Jumeirah. And under Kamali, what kind of disciplines do you have? What kind of titles do your colleagues have, Tuba?
Oh, so we have clinical psychologists. We have counselors. We even have adult and child, separate teams. So we have adult psychiatrists, child psychiatrists, as well as some ABA therapists. And then we have speech and language therapists, occupational therapists, dietitians. Yeah.
And I think that's where people can feel a bit overwhelmed. Sometimes you're feeling really low and maybe desperate and you just think, okay, I need some help, but who is the right person for me? So when it comes to establishing the person that can offer the help, how do you decide and what's your first port of call?
So, the first step to knowing, if you need therapy is just, seeing if there are any signs that you might want to seek help for, if you're worrying more than usual, finding it hard to enjoy your life, having any feelings or thoughts that you find it difficult to cope with. So the first person, that you can go for is just your local GP, so that they could offer you treatment or refer you to a mental health specialist, and so that they can, filter out any other diagnosis that might come in the meantime. So, for example, before we call someone depressed, we have to make sure that they don't have, instead of, having a vitamin deficiency or a thyroid problem. So we need to rule out those things. And psychiatrists, because they have a stronger sense of biology and neurochemistry, so they're trained to do those. Whereas us psychologists, we're more focused on behavior, actions, and what are the root causes of, let's say, sleep patterns, eating patterns, past traumas, lifestyles, etc.
I think that's a really good point about the GP, and that's who I went to see when I had postnatal depression, who then, introduced me to someone who I could go and speak to who was more of a counsellor. But when it comes to medication as well, it is the GP, it's the psychiatrist that can prescribe. You mentioned counsellors there as well, so there is an awful lot to kind of think about. And I know this is a bit of a strange question, but do you have a typical client? Or is it literally people from all walks of life, Tuba?
It's basically all of them, but because I'm under training right now at the moment, I do not take high-risk clients. So I can see adults and adolescents who have different emotional and behavioral problems. That could be mood disorders, anxiety disorders, self-esteem issues, relationship issues, any lack of motivation, unresolved issues with their past, just like obsessive compulsive disorders, and the like.
And do you, as a clinical psychologist, do you get support as well? Do you get the help that you need to help you process all of these stories and all these emotions that you are dealing with every day because of your clients?
At this moment, since I have a supervisor, I can discuss any issues that come up during therapy for me, but otherwise we always have an option to go for our own therapy or even discuss with colleagues if you're having any issues.
And we've had a message here, actually we've got quite a few to address this afternoon. One saying, I went to see a psychiatrist due to anxiety, but he advised me to see a psychologist instead, which I think is, a really valuable insight as well. An anonymous message here saying, I have trouble knowing my feelings. When I'm presented with difficult choices, I find it hard to know how I actually feel about things. How can I tap into genuine emotion? Thank you for sending that in. I think that's a really, really good question. What do you think, Tuba?
I think that a psychologist would be a better option because we're more likely to work with specialized populations such as, anxiety disorders. So we would use more of the evidence-based techniques such as cognitive behavioral therapy and manualized treatments, do like a proper assessment and, decide on the type of treatment that the person would need, so that we can change, so that, the person himself can be able to treat his life changes and stressors more.
And I know this might sound a bit odd, and you obviously have clients all day, every day. I'm a massive advocate for getting therapy. I feel like everyone at some point in their life or at all points in their life can do with someone to talk to, someone who doesn't have an agenda, who doesn't have a viewpoint or any kind of biases. But for anyone who hasn't been in therapy or been to see a counsellor, either, one time or on a regular basis, what happens in that room? How can you kind of lift the veil a little bit and explain what people can expect when they go to see a mental health expert for the very first time?
Right. So the first few sessions actually are about just gathering information and knowing about your needs. So maybe the psychologist would give you some forms to fill out about your current and past, like physical and emotional health. And then it would take a few sessions for the therapist and you to fully understand each other, your situations, concerns, and to determine what the best course of action would be. So after that, the sessions usually are 45 to 60 minutes. So you have to visit them once a week, and then every other week after that. So there are also group sessions as well that people do, but a typical session would be like having an appointment and going to see your therapist once a week for around 60 minutes.
Tuba, thank you so much for joining us this afternoon from Kamali Clinic. As I said, can be found at Medcare Medical Centre in Jumeirah. Really important conversation and really useful insights there. So thank you very much for your time.
Healthy habits.
On Afternoons with Helen Farmer.
It is the Psychology Hour, and we're asking you today, have you ever felt like you don't belong, like your friends or colleagues are going to discover that you're a fraud, that you don't actually deserve your job, your accomplishments or your place in life? If so, well, in honesty, you're in good company. These feelings are known as Imposter Syndrome and what psychologists often call the imposter phenomenon. An estimated 70% of people experience these feelings at some point in their lives, according to a review article published in the International Journal of Behavioural Science. To unpick this and offer some advice is Dr. Thrier, clinical psychologist at the Human Relations Institute and Clinic. How are you, Dr. T?
I'm good. How are you, Helen?
I'm good. I'm looking forward to the long weekend. I hope you're going to have a nice rest.
Yes, we're actually taking Sunday off, so we're excited.
Good. As you should be. We were just talking to Tuba there from Kamali Clinic, and I was asking if she gets the psychological support that she needs, because, I think it is such an important thing that you are there as these amazing, resilient resources, but that you're, getting a bit of downtime and a bit of support too. So enjoy yourself. But you're not off yet. You're working hard with me until 4:30. We're talking about imposter syndrome, and I'd like to go back to the beginning. Where did this name and the concept come from, Dr. Thrier?
Well, it's very interesting. It's actually not considered a formal diagnosis, but it has been found quite a while ago. There were two psychologists who had noticed that a lot of women had been experiencing imposter syndrome, and so they had done quite a few research studies on it. And then after that, I'm trying to remember their names. I think it was Dr. Pauline Clance and Dr. Suzanne Imes. And
don't say it as if I'm going to go, that's correct. You're the expert.
Well, to be honest, I'm not very good with names, so if I got those right, I'm going to be really proud of myself. And so they had done quite a few research studies regarding women and imposter syndrome, and then when they extended their research, they found that quite a few men had been experiencing imposter syndrome as well. And so this is why it became more of a phenomenon and not necessarily something that was diagnosable.
And I mentioned there, feeling like a fraud, feeling like you're going to be discovered. What are some of the symptoms? Because I can practically hear people nodding along across Dubai, because 70% of people are having these feelings. What are the symptoms that you as a psychologist would be asking about?
Well, usually what it is, it's quite related to feelings of severe inadequacy and self-doubt. And so what a person feels like is that they're a fraud, and that anybody could really do what they're doing, and that they don't really recognize their achievements. They consider it almost as, luck, if anything, or circumstantial, that they have achieved the things that they have achieved. So a lot of the symptoms have to do with self-doubt, with feelings of severe inadequacy, as well as not recognizing one's accomplishments.
And are there different types of imposter syndrome, do you think?
Well, not so much types, but what I would say is that there are a lot of patterns for individuals who have imposter syndrome. So, for instance, mostly individuals that experience perfectionism tend to experience imposter syndrome. So, for instance, those that set really high expectations for themselves tend to feel that, these expectations, even if I achieve a lot of them, anytime I don't achieve something, this goes to almost proof and evidence that they are not actually as good as they think they are. And so that perfectionism, and this is something that I experience quite a bit with a lot of my clients, where they say things like, I should have done better. I should have done it like this. It should have looked like that. And I say, well, what you're doing there is you're setting yourself a 1% success rate and a 99% failure rate. Mm-hmm. And so for perfectionists, imposter syndrome could be quite significant for them in the way that they feel, but also individuals who are labeled as experts. And this could be a subject matter expert, for instance, either in the IT world, in the medical world, in the business world. They feel that they have to know everything about everything in order for them to be considered an expert. And when there's something that they don't know, they almost feel like a fraud. So, I'm not an expert because I didn't know this. Whereas they're not really considering the fact that new things emerge on a daily basis.
Yeah, and they can't possibly be experts in all areas.
Absolutely.
That's really, really interesting. And can I ask you, Dr. Rao, how does it relate to self-esteem?
It relates quite significantly, but not so much so. So in some areas, lowered self-esteem can contribute quite significantly to imposter syndrome. However, you also have individuals that are kind of like those that are on a very high intellect level. So we call them like the natural super intellects or geniuses, if you will. And for them, they don't really struggle to get to where they are. And so they don't really feel that sense of accomplishment. And then whenever there is a struggle, yes. And so whenever there is a struggle, it almost hits them like a brick in the face, where they're like, wait a second, has all of this been chance or luck, or has my life been easy this whole time? So even, and that's not really related to lowered self-esteem. That is just a natural kind of a person who tends to have some things come easier to them, might struggle. And this I see quite a bit for a lot of teenagers who have high intellect that really don't study much. And then when they get to university, unfortunately, they drop because they've never really built the skills that they need in order to learn how to study. Mm-hmm. And so when they get to university, they crash. And then they feel like failures, and frauds, and it becomes very difficult for them to kind of readjust and work towards identifying that no, it's not that they're not good at what they do. It's just that they've never really acquired these skills because they were never needed before.
Yeah, never been challenged. It was interesting you say that about kind of super gifted people, because Jermaine Jenas, footballer who's represented England for years, about 6 years, recently revealed that he struggled with imposter syndrome during his career due to kind of perceived preferential treatment of star players. He won 21 caps, part of the 2006 World Cup team. Under no circumstances could it be, put down to luck, but it's something he recognised. And I think it's so useful for men, especially men in high profile spotlight positions. And he said on a recent podcast, I had a couple of moments struggling with imposter syndrome throughout my career as a player. It was playing for England, nothing to do with my ability, but I didn't feel deserving of the position I was in. And I think it's interesting as well, you talk then about kind of being in challenging circumstances that you perhaps have never found yourself in before. And this affected me a lot when I became a mum. And I feel like a lot of parents suddenly find themselves in this thing. Well, I'm not qualified to be here, or I'm not deserving of being a parent, or how did this happen and I'm going to be found out? This baby's going to be taken away from me. Obviously hormones must play a role there as well. Of course, absolutely. I mean, ultimately, it's like you had mentioned, the fact that it kind of comes slightly easier to them, it makes them feel like they're not good enough. It makes them feel like they're not doing good enough. And that actually happens with a lot of women in other senses when they have babies, where a lot of people are kind of giving them this advice on how to work with their children, but they seem to have it figured out without the help. And so they start to think to themselves like, oh my God, am I doing something wrong? Am I hurting my child? And even though the child is fine and everything's okay, but that self-doubt starts to kick in. And unfortunately, it makes women feel somewhat inadequate. 100%. And this is something I realized quite early on, all the way through pregnancy, and then even now my kids are a bit older, that need for validation from both myself and from other people. And it can be the strangest little things, like someone saying, what buggy do you recommend? And I'll be like, well, you should get a bugaboo. And if someone takes that recommendation, it feels like that decision's been validated and that I'm doing a good job. Does that make sense? And and I think that's why a lot of people kind of struggle a little bit with unsolicited advice, either giving it and receiving it, because nobody knows what they're doing in parenthood. Exactly. Nobody has a notion, but you feel, whether you're new in a job or you're a new parent, that everybody else has this code, and they've cracked it. They know the secrets, and you're there just trying to kind of fumble along in the dark and make the best way. But I think that's also a really valuable lesson in not comparing.
Absolutely.
That's such a tricky thing. And I would say that in, the hashtags we see, boss life and, boss babe and, all this stuff on, professionally and in terms of parenting as well. Not that helpful. And I love social media. I get a huge amount of enjoyment, and I feel like social media is a brilliant resource for so many people and bringing communities together and all of that stuff, but it is quite unhelpful, I think, when it comes to imposter syndrome.
It definitely can be, because unfortunately what we're seeing with social media is truly half of it is fake. Right? So not a lot of the things. I'm trying to be nice here, Helen. I mean, in reality, a lot of what people are showing online is fake. And when you see the boss lady and like the woman that has it together and she's working so hard and she has like 4 kids.
Dry, boom, boom,
yeah,
boom.
And she looks at her immaculate self all the time, and you're just like, what am I doing that's wrong? And the reality is that actually, she doesn't look like that. She has a team of people that are making her look like that, and she has a team of people that are helping her out. And not everyone is privy to that. That has that privilege,
Yeah, and she's not showing the process.
Of course.
Doctor, I'm wishing you a wonderful long weekend. Get some rest.
Thank you. You too.
And we'll talk to you very soon.
You've been listening to a Dubai Eye 103.8 podcast. To enjoy lots more from Dubai Eye in the United Arab Emirates, just go to DubaiEye1038.com or find them wherever you normally get your podcasts.